Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. He's also in his favorite month and Nil's favorite month.
Oh, I love it.
It is spooky month. Like, cue the ghosts. Cue the pumpkins. Cue the skeletons. I don't know. What else comes out in Halloween?
Yeah.
So
What episode was that when Nils... That was like one of his first editing triumphs.
I think it was like 3 years ago in October or something.
And you put all the ghosts that came with...
The ghosts.
Yeah. And then you put like a witch's hat on me or her or somebody.
Yep. So if you are just watching us for the first time on YouTube, you can find us at Jason Martin MD. You can also find all of our social media handles below. Check us out on TikTok. We've been putting out some new stuff on TikTok, and we like it. Took me a while to warm up to TikTok, but now that I have, I'm a fan.
Yeah, we're kind of digging
liking
TikTok.
it. I like that it has the ability to have longer format, which I really appreciate. So that's why it's been kind of cool to put out some little bit longer videos. This video and podcast episode is all about questions and comments from you, the listener, which are our favorite ones. We did part 1 a couple weeks ago, and this is now part 2. And I told Dr. Martin and Nils that there's some really good ones in this episode. Some questions we have literally never had before in any way. I mean, like some real new ones. So I loved it. Keep them coming.
Part 1 was amazing.
Yep.
The questions were really good. If you haven't listened to part 1, you should listen to that too. Such good questions.
And while you're at it, do us a huge favor and subscribe.
Yeah.
We would love it. All right. So without further ado, let's jump into our first one. This is from Sheila McCurley, 7084.
Okay.
It was on episode 134, Everything You Need to Know About Face and Neck Lifts.
Let's go.
When can you start back into weightlifting?
Oh, such a good question.
Yeah. So I love this question because we are all about maintaining muscle mass. Sheila is great. She has commented on a lot of our episodes about longevity. Like, clearly she is one of us. She's in the tribe. She cares about healthy aging, and she knows that muscle mass is part of that.
So she likes to weightlift. Do you think that she's so in the tribe that she boxes like you and Nils, or no?
Maybe.
That's a good question.
Yeah. So what I told Sheila was we have our patients can start doing light lifting, nothing where they're straining, but just some really gentle, easy weights, body weight exercises, that kind of thing around 2 weeks post-op. But that you should plan on 6 to 8 weeks of lower intensity weightlifting than you're used to. And certainly nothing where you're straining at the neck or could really elevate your blood pressure in a rapid way.
So Amy, what is the concern with weightlifting and facelifts? It would be very specific.
Yeah, it's the straining. And that's why I mentioned the straining component, in raising your blood pressure.
Right.
So bearing down, I mean, when you're really lifting hard, you could be straining, through your entire body, but also through the neck and face. You're having a rapid increase in blood pressure during that moment. And that could definitely increase your risk of having a postoperative bleed and or swelling.
Yeah, when you bear down, you're valsalvating and you're locally increasing the blood pressure, just the pressure in your vessels. Yeah. In your head and neck, which is the one area you don't want to do that.
Yes. And
you can I've seen it during training that someone was 4 weeks out from a neck lift and was bearing down and got a hematoma, expanding hematoma on their neck, which is really, really scary. So it's so important. And it's not just weightlifting, it's lifting anything heavy. It's even sometimes going from a sitting to a standing position. So, that feeling that where you really crunch in your core and you're straining very hard, that's not good after a facelift.
Or rapid changes in blood pressure. I mean, I know for me and Dr. Martin as well, I'm sure. I mean, when you're doing a really heavy set of something, like you can almost get like faint feeling just because that blood is shunting, to that area.
Today.
Yeah.
And then I started laughing at myself at 7 a.m. at the gym when no one was there on a Saturday. Yeah. And I'm like, I'm going to pass out with a weight on my head.
Right. Like breathe deep.
Why am I lifting this stupid heavy weight?
Like you wonder, like, am I going hypo or am I just like
exactly
shunting all the blood to my glutes?
I had to back it down from there.
Yeah. So don't always check with your surgeon, and Sheila, I know you will because you're amazing. So thanks so
Sheila.
Much. That was a great
We love
question.
you, Sheila.
The next one was from episode 146, which was supplementation around surgery 2.0, and this was from Maria Moore Asavente.
Maria Moore Navicente.
Yes. Yeah. Any particular supplement you recommend for rhinoplasty? So my response to Maria was everything in the episode, obviously. However, if she was looking for my top 3 for rhinoplasty specifically, I would say Trameal.
Please put this right here, like top 3. Okay, number 3, Trameal.
Yeah, right, the top 10 list. Now I feel like I can't remember because I got prep brain. But Trameal would definitely be the number 1, the zinc complex and the B complex. If I had to just pick 3, those would be the 3 I would pick because you're covering your bruising and swelling. You're making sure that all of your micro and mineral vitamins.
I was going to say zinc. That's so funny.
Yeah, the zinc supreme.
Yeah.
And B supreme. If you were only to pick 3.
I actually listened to you. I was going to, zinc popped in my head when I read that question. Okay,
yeah.
Good.
And to manage the swelling.
We're
Yeah.
so we're
Right?
Nils.
Yeah,
You and I may pass this class.
Yes. Supplementation around surgery 2.0 pop quiz coming right up.
Oh, no.
What is the recommended dosage of phosphorus following anesthesia?
Nils is such a nerd. He's taking AP supplementation around surgery.
Yeah. So,
He's going to get college credit.
but I highly, highly, Maria, recommend listening to our episode that just came out a month ago at this point about the things you wish you knew about a rhinoplasty. It's a great episode.
Yeah.
It's really, really good.
Yeah.
So thank you so much. This is a great question. I love that people listen to these episodes still. And as you saw from episode 1 of this series of our questions from listeners with Jenny, she had better blood work going into her second surgery because she did all of the things that I had recommended in the first 2.
Right.
The nutrition around
So
surgery.
what
and
Amy's really saying
supplementation.
is it's Amy caused her better blood work. Good job.
I didn't cause it. She caused
I'm
it.
joking.
She caused it by following my advice.
No, I totally agree. Actually, this supplementation episode is one of my favorites of all time.
It's really good.
It really was.
Yeah. Awesome. All right. Oh, love it. This is also from Sheila. This was on Research We're Into 7.0. So my question is this. Since aging causes us to absorb less nutrients from our food, then would I actually benefit from supplementing with taurine? Would this be a true assumption? What do you think, Dr. Martin? What would you say?
Actually, listening to you during that episode, because I was sitting right next to you, and I thought it was pretty interesting. I'm not sure that you would have to supplement, but you would maybe you would suggest supplementation, but it might be good to at least adjust the foods you're eating.
So interestingly enough, I have an update from Sheila, which I love. So Sheila is past her 6th decade of life. Let's just say that. She did say her age, but I don't want to throw that out there. She is...
Brad Pitt, 60.
She started supplement. I'm not here for that kind of negativity, Dr. Martin.
He looks amazing.
I'm sure Brad Pitt is 35.
Tom Cruise is 63.
No, stop it. If anybody
And
says
he jumped off. Did you read that? He didn't even get paid for that. He jumped off the top floor of the arena in Paris.
Yeah, he belayed himself down facing forward, then got on a motorcycle, and then
drove to L.A. Yes, over the
60
water.
is the new 20.
Yeah,
I don't know.
Sheila's fine.
It is 1998, and I don't know what you guys are talking about. Brad Pitt is like 30. Anyway, Sheila. So she gave me an update. She started taking taurine, so she started supplementing with several grams a day and was able to come off of her blood pressure medication. Her doctor took her off her blood pressure medication because one of the benefits we really talked about with taurine was its benefits for cardiac health.
Yep.
So yes, Sheila, I'm glad you started supplementing. Since that episode, actually have started supplementing with taurine. I have not seen any direct benefit, but there's also nothing that I was needing to monitor. But the fact that you were able to come off of that your doctor actually took you off of your blood pressure medication after being on taurine for several weeks.
Yeah.
I mean, that's amazing.
So if you wanted to adjust your foods, you didn't want to supplement, what would you eat? Just kind of reiterate.
Yeah. So if you listen to this episode, you'll see my recommendations at the end of my spiel or end of my portion, which will be timestamped in the episode description. Really, it's having a whole food healthy diet.
Right.
So
That's
things like egg yolks, meat, shellfish. Yeah, you can get it from supplements.
Seaweed, I remember.
Yep. See, Nils listens.
AP Nils.
Yeah, Nils listens. But as Sheila so rightly noted, we absorb less nutrients as we age. And that has a lot to do with our gut health in general and just the way our body has an ability to break down proteins in food. So would I recommend supplementation more as we got older? Most likely, yes. And that's what I loved about this research was that it was done in middle-aged mice. They didn't supplement them from birth. They started supplementation at middle age and saw all these benefits.
So kind of reiterating or going back to what you always say, you can start with adjustments in your foods and then go from there. Then you can supplement after that.
Yeah. And if you have a higher need, you may have a higher need for supplementation.
Exactly. How much is taurine supplementation?
What do you mean, how much is?
How much is it a month?
Oh, the cost.
Yeah.
I wasn't sure about the dosage.
Yeah, how much?
It depends on literally you could buy taurine that's extremely expensive or taurine that is very expensive. You don't have to spend a lot of money on taurine,
okay,
but you could. It's like any supplement. Like there are, supplement companies that are going to charge you $50 for a small bottle and other companies are charging
So it's not outrageous.
No.
Not like NAD or something.
It is extremely reasonable. Actually, NAD is reasonable as well. So no, it's very reasonably priced. I see no downside of supplementation. All things considered, definitely check with your doctor, which Sheila did, and then was actually able to come off medication.
Good job, Sheila.
So awesome. Love it. And I love that Sheila, like I said, she's one of us. She's one of us pseudo hacker biohackers.
Yeah.
I love it. All right. So these were great questions. This both from Mary Hampton 3079, but on 2 different episodes. So let's talk about her first one first. Her first one first. This was on episode 134, Everything You Need to Know About Face and Neck Lifts. wondering how you would address hollowness in the under eye area. I don't even know what word that was, Nils. I really don't. If you can translate that into English, please help me.
Nope, but it's going in the mix.
Yeah. Under eye area, areo, nano.
Nano fat transfer or fillers. And then the next question was almost a follow-up. Maybe talk about those who have had prior blepharoplasty and with aging are now hollow with some excess skin. Do you recommend fat transfer?
I could speak for an hour on this. So the problem is, historically in the old days, and who knows when she had her blepharoplasty, they would take out too much fat. They would hollow people out.
They take it all out.
Yeah. Yep. And then they started to wise up. They're like, why are we taking out fat that you actually need in the face?
It's like liquid gold.
If you look at a baby, the big chubby face, cherubic face, they look beautiful, right?
If you look at me from 2 years ago.
No, not now. With the body competition. So the point is that if it's gone, then you have to supplement that. If it's not gone, if you're doing a blepharoplasty, then you take out just enough fat that you need to take out. And then when they started doing this transposition of fat along the tear trough area of the lower eyelid.
Yeah, why not keep that fat?
Yeah, exactly.
Yeah,
and there's a lot of surgical procedures with that. If people like our office to do these facial procedures, they should be comfortable with all these kind of techniques. But this is a really good question. So you've had a blepharoplasty, and now you have hollowing. And this is a lot of people out there. Mm-hmm. Amy, which way would you push them? Would you push them to fillers? Would you push them to fat? Would it be dependent on their exam? What's your general feeling on that?
Very dependent on the exam. However, I would say in most cases, I would always go toward fat because it is a long-lasting solution and it doesn't run the risks that filler does. Filler can migrate, and it can also cause, not as much anymore with the different techniques for injecting, the bluing that we used to see with the old school Juvederm. Which
you still see it.
You do still see it. And you can... There's just something about filler in those areas you can almost visualize through that very thin
We've
skin.
seen 4 patients in the past 3 months, not our patients, I mean, just coming in for consults, who've had transposed filler in different areas of their lower eyelids.
Yep.
Now.
Meaning it's moved.
Right.
Migrated.
I of course, 100% agree with Amy. But there is a benefit of fillers, actually. Mm-hmm. You do the fillers first to see if you like how it looks. Because fat, you cannot remove. There's an antidote to filler, which is called hyaluronidase, if you use, hyaluronic acid. Mm-hmm. So you can put the fillers in first along the rim, orbital rim, in the area of depression and hollowness and see, hey, I kind of like how this looks, and then do the fat after that filler goes away. We've done that before, too. And I like that because that's like, you don't get a buyer's remorse. Also, fat transfer to lower eyelids, extremely hard.
Yeah, it's going to bruise like crazy.
It bruises like crazy. It's technically driven, so you better go to someone who knows what they're doing.
So is filler under the eyes. I mean, you should go to someone who really does a lot of it.
Yeah. I feel, you're right, too. I guess, nurse injectors and people that are really comfortable with injecting, I think, are pretty comfortable going along the eye. But when I do fillers on the eyes, I go right on the edge of the eye, right on that bone. And I'm not really sure that nurse injectors are always comfortable with that. Yeah. And that's what you have to do. You have to fill in the area of hollowness. Yep. So. Yeah.
So these are great questions, Mary. Really good. And I love that it was the same person.
It's kind of like an Easter egg. Yeah, I know. Yeah. She's like leaving little questions.
No, because it was perfect.
Like the Marvel universe.
I was able to see them both. I'm like, oh, perfect. Like it's 2 different episodes, but it's the same person, like same question essentially. So this was a great question, Mary. Thank you so much.
She got some more Easter eggs out there.
Yes.
I think.
So now we're going to take a quick break. I always used to say get a word from our sponsors. Like I wish that, like, Nils, keep it the rainbow, the more you know rainbow, or is that trademarked? The more you know. We love Element, While we're taking this break, give us a like, and we'll be back in just a moment.
See you soon.
And we're back. And we're back with a way back. We also had one of these on our first question.
You guys are going to such OG episodes.
Episode 37.
Yeah.
Tummy tucks.
They're hard to watch. We're a lot more professional now.
They are hard to watch.
And this is from Bobby Mommy Chio 6302.
Yep. Can Lipo 360 be done with a tummy tuck? The Lipo is for the bra fat and both sides, upper back and flanks. So before you answer, Dr. Wright, I did respond to her, but just I think there's the misconception here is that there can be 360 lipo, that what she's looking for is 360 lipo. She's actually looking for lipo on the back with a tummy tuck, which is different.
So they talk about 360 lipo, which is just a marketing term.
It's a marketing term.
I mean, we've been doing 360 lipo since Amy and I started working together.
Became a thing.
Since the beginning of time.
Since the beginning of lipo.
Since they invented fire. So 360 lipo just means you're contouring the trunk circumferentially. Mm. And of course you're going to do that because you wouldn't leave. If you're going to contour your front, you're going to want to contour the back because you want to look good in clothes. You want to look good in bathing suits. And so we've been doing 360-degree lipo for a long time. So they just put a term to it. And so people would say, oh, I want 360 lipo. Also, combining liposuction with tummy tucks, Amy and I have been doing that for forever because you're not going to make the flat front again, like we said before, and not address the sides, which is the flanks.
And it's a rare patient who doesn't need their flanks.
It's pretty much every single one.
I would say 1%.
Maybe Amy right
time.
now, pre-prep.
Yeah,
whatever.
in prep. Yeah.
In prep, sorry. But if you're doing the flanks or the sides, why wouldn't you do the bra line?
If you need it.
Yeah, why wouldn't you do the upper back? Why wouldn't you do your saddlebags or your inner thighs or whatever? And we do that almost every single case. So, of course, Bobby and Mommy, for sure, if you're going to have a tummy tuck, then do the liposuction in those other places. It will make your results better. It's not going to increase your recovery. You might have a little more pain for sure, but it's not going to increase your recovery time. And then also long term, you're going to just be much happier with those results.
Well, that's really what I said to her as well. Like, I always tell patients who ask about additional areas of liposuction, like, while you're going under anesthesia, if there is any other area on your body that you want liposuction on, get it done.
Right.
You're combining your recovery. Like Dr. Brown said, it doesn't add to your recovery. You might be more sore in those areas, but you're going to be sore anywhere. Like, get it done.
And it's not an upsell from us. Like, we're saying this to you, like, educationally speaking and from an empowerment standpoint. If you have areas you don't like and you are going under anesthesia,
take care of them.
Just like look at every area acerbically, critically. Do you want to do this or not? This is the time to do it. It's probably going to be more cost effective also to combine surgeries with the anesthesia and OR costs. So it's worth it to do it as long as it's you don't have any reasons not to, medically speaking.
Yep. Well, and if you're having surgery, then you're medically cleared. So,
so
you're good.
You know what I'm talking about.
Yes. So great question. The one thing I will say is that the one area we do not liposuction with a full tummy tuck is the abdomen. So you would not be getting technically 360 liposuction with a full tummy tuck.
If you did a mini tummy tuck, you could do the upper abdomen. You can remove the scavenging fat. Go back to our tummy tuck episodes, not this old one. We have ones more recently than that. We talk about removing scavenging fat, but it is not wise to liposuction your whole abdomen and then do a tummy tuck at the same time. People do it. You have a much higher risk for wound breakdown, infection, and skin and fat loss.
Yeah. So get the tummy tuck, get as much lipo as you want, recover all at once. You're gonna do great. All right. So next one, this is the one, Dr. Ryan, that this was a question that we have never had before. Yeah, and I'm going to let you read it because it was just such an interesting question. Like, I have to put this on. So this was on our thighplasty 2.0. This was
in a vertical thigh lift.
Nina Krinis, 7210. So please read the question.
Okay, yeah, sorry.
You have to read the whole question.
Okay. In a vertical thigh lift, or called bilateral thigh lift, rescar one scar from inside groin to the knee, do you remove the great saphenous vein? As a surgeon told me, it gets in the way and could die or dies.
Has anyone ever asked you that question?
No.
Right? I was like, wow, like this was interesting. I'm wondering if it was a plastic surgeon that told her this.
So
that it would get in the way of the scar is what she's saying.
Yeah.
So RE, the scar, the scar on the inside of the groin to the knee would get in the way of the vein.
Right. So number one, a vertical thigh lift, let's describe what that is. It goes from your inner knee up to your groin. Mm-hmm. And that's for people that really have laxity or loose skin from basically the hip all the way down to the knee. And those are usually, massive weight loss patients. Bilateral thigh lift, rescar one scar from inside the groin. What does that mean?
She means RE the scar, not re-scar. She's not saying re-scar. She just means RE the scar.
Oh, regarding the scar.
Regarding the scar.
Okay.
Yes.
All right. I'm sorry.
She's clarifying to us.
I got you. She's younger. I got it. Okay.
She's clarifying to us what she means.
I understand.
Yeah.
Okay. Gotcha.
Full thigh. She's talking about full thigh lift. We get it.
Got it. Yep. Full thigh lift. So this is such an interesting, I guess theoretically you could remove the saphenous vein inadvertently when you're going through and removing skin. What I do for thigh lifts, me personally, and this is my technique, so you have to figure out what other people do too, is I liposuction before I remove the skin. And the liposuction technique will not, in most cases, violate that saphenous vein. It will preserve it, and then you just remove the skin.
You've debulked it.
Yeah, you've debulked it. And then so you still have the vein and the lymphatics and everything there, and you're just removing the skin on the outside. So I would say no, hopefully. And also anatomically speaking, this gets into the weeds. Mm-hmm. I'm a little curious about this question. So I'm not really sure how this question was posed to the surgeon and why they answered that way. So at least in my experience, for a vertical thigh lift, you're not removing that saphenous vein. Now, the saphenous vein, not that we do this for a living, is an important vein. They use it for bypasses. It's a anatomically important vein.
Mm-hmm.
If you're someone who has venous insufficiency, and
I was just going to bring that up. Yep.
and you remove this vein, you could have worsening venous insufficiency. Has anyone who's listened to this podcast had children and now has varicose veins?
Mm-hmm.
You know, I mean, come on.
Or just with aging, then, because the valves become less efficient. They get leaky.
Right. So it's important if you're doing these elective surgeries to maintain the structural stuff there. And we do that all the time. And in places that it's necessary, like the face, you don't want to have it violate the nerves, which affect your face. That makes sense to you. But in areas where maybe it's not as important in your mind, like your arms and legs, of course, you want to maintain all that anatomical structure, the veins, the arteries, everything that's there. So you should not violate these kind of
Well, even if you were to bifurcate it, let's say that it was cut during surgery.
Now, you could theoretically, a branch of it.
Right.
That's what maybe they were talking about.
I think that's maybe what they were talking about.
Yeah. And that, I think, would still be okay.
Yeah.
Because you do that sometimes for varicose vein.
Like vein stripping.
Vein stripping and varicose vein surgeries. Yeah.
Yeah. Yeah. But fascinating question. I mean, this was a first for us, which I love. So thank you so much. That was a great question, Nina.
Sorry about the regarding scar.
Regarding the
Okay. I got it. I'm 50.
All right. So the next one. LOL, right? LMAO.
That's like rescar. Like, why would you rescar a scar?
They're not rescarring anything.
Okay.
All right. So episode 156, this was from Lorraine Clogan. Coughlin?
Oh my God.
Coughlin? Sorry. The dyslexia sometimes really gets me.
All right.
Everything you need to know about facelifts, part 2. What about someone with alopecia? Obviously, the scars will show.
We've had a patient like this.
To know how you have done surgery on anyone with alopecia and what was the outcome.
Yep.
What foods and fluids should be avoided before surgery? Heard ginger is one of them. And heard eating pineapple and taking arnica for bruising and swelling is beneficial. Also taking bromelain supplements. What are your recommendations? Looking for a great surgeon in Ireland, Dublin. Know anyone?
Listen, I'll find you the surgeon, but we want to visit. So when I come over there, you show me around. I'll find you the surgeon.
We'll get temporary privileges at the hospital.
Yeah, I'll come over to do surgery. I'll write it off. It'll be business expense.
Bring me and Sarah, so it's podcast.
That's right. It's also a
We'll film the whole thing.
Yes. We'll film
That's not a tax write-off, is it?
So, Dr. I'll let you go first, and then I'll do the supplement questions after.
So we've had a patient with severe alopecia, literally no hair. And you do the surgery fairly, actually pretty similar to what you normally do. What I had her do is bring in the wig she wears, okay, on a regular basis. And we kind of marked out where that goes. And we made sure the scars in the occipital hairline or the hairline behind the ear or where that would normally be, those scars would go in there, wouldn't show. So the other option is to only do the scar around your ears and not up to the temporal area or where the sideburn would be and the hairline behind your ear or where the hairline would be. But that's not going to have as good of a result.
We do these surgeries on bald men.
All the time.
Mm-hmm.
And the scars also heal really well. Mm-hmm. We just did a guy who has male pattern baldness and thinning hair back there. And you see him 3 or 4 weeks later, you can kind of see the scar, but it's not really that visible. Amy always says the same thing, which is absolutely right. No one's looking behind your ears.
The only person who looks at anybody's ear is me because I look at Dr. Martin's ear, just like this.
And I look at your ear just like this.
You can't see it, covered by my hair today.
Yeah, okay. That's true.
Yeah.
I never know what your hair status is going to be. It's kind of like I need to look at like the Chime app for what the weather is going to be.
Right.
What's the satellite radar show?
Yeah.
What's Amy's hair? Is it up or down? It's like humidity or barometric pressure.
And when you have curly hair, it's kind of one of those things where you can't really control what it's going to do. If you don't like it, you just have to like literally wash it again. So
yeah,
it's going to do what it's going to do. So
you can definitely do it. We encourage you to do it. If you go to a reputable surgeon, what we're going to find for you in Ireland and Dublin, then they'll do a good job. And most likely you may or may not wear a wig or a prosthetic or whatever the term would be. But if you do, they can put the scar where it's hidden by that.
Yeah. And I am guessing, Lorraine Coughlin, that you have beautiful, fair Irish skin that is going to scar beautifully and you're going to have a completely invisible scar.
Yeah.
I mean, that helps too. Like knowing when you're fair skin, fair scar, it may take a full year for your scars to not be red anymore, but once they aren't, they'll be like pretty much invisible. I mean,
Gone.
yeah. When I scar, you can't see it.
Or Amy's scars are like super red, and then they're completely
white.
gone.
Yeah, like completely gone.
Like within 3 months.
Yeah.
It's like the party was like raging, and then it's over.
gone.
Yeah.
Then no one knows.
So what about the ginger?
So these were great questions. So ginger, yes, you do want to avoid large quantities of ginger prior to surgery. And when we send our patients the list of supplements and foods to avoid, ginger is one of the foods to avoid, because you don't want to consume it in an extremely large quantity. Little bits of ginger here and there, like if you're doing a little bit of grated ginger on some, Asian food, you're fine. Now, if you're juicing with ginger, and that's what I tell people on these foods lists, if you are juicing them or consuming them in more quantity than you would season food with, it's too much.
So I've worked with ginger before.
Mm-hmm.
How the hell are you going to juice that thing?
Oh, it's really, I put it in a blend. I just put mine in the blender.
But like, do you peel it first and then do
peel it?
But then there's a lot of pulpy
No,
stuff.
the blender chews it all up. Look for me.
That sounds
or I put it in a regular
disgusting.
juicer. Like, yeah.
Yeah, no.
Yeah, I put ginger in my smoothies all the time.
Are you feeling me? Yeah, okay.
Yeah, I like cooking with it.
Yeah.
But too much of it is too much of it.
Right.
That's actually a great point, Nels, because if you cook it, it does break down those enzymes that kind of keep it from...
It dulls the flavor a lot, too.
Well, it also dulls the effect of the blood thinning.
Yeah.
So if you're cooking with it, I wouldn't worry about it.
Which is the big thing, the blood thinning, and garlic's the same way, right?
Correct.
Yeah, okay.
Yep. Yeah. Pineapple after surgery is great. Bromelain is what is beneficial in pineapple. So eating raw pineapple is great. I always would recommend eating whole foods versus taking a supplement when you can. However, eating large quantities of pineapple right after surgery...
Tear up your mouth.
Yeah, it can tear up your mouth, can have some GI distress too. So I like taking bromelain. The other thing you want to do with bromelain when you're taking it for bruising and swelling is make sure you're taking it away from food. I love people adding pineapple to their food because it does help with digestion. But if you're going to just take it for supplementation for swelling, I would just take the supplementation. We love arnica. I don't know if you get it in the UK or in Ireland, but we have a supplement called Trameal that we really like. It's a bromelain. I mean, there's so much more homeopathy in other countries, so I'm sure you have something that's probably even better. But looking for an arnica bruising and swelling supplement that has like many homeopathic ingredients is what I would recommend. Yeah, those are my recommendations.
Apparently, Ireland has really good tax laws for corporations. So there's a lot of medical companies that are prominent in the United States that have headquarters in Ireland. I didn't know that. Like,
so we're
at one point,
we're going to build a shell company. Is that what you're saying?
Yeah, at one point, Allergan was actually based in
Oh, that's
Ireland.
right. I remember that.
Do you remember that? Yeah.
Yeah.
I mean, then they got bought by some other multinational company. So
interesting. Well, Lorraine, we love it. And my advice to you for finding a good surgeon, I'm sure there is a registry board, like there is.
There is.
The Royal College of...
Yeah. So, and I don't really know the names, but I know that in England and Ireland, they have those registry boards.
Yep.
They have certified training that's really, really good. Okay. And I think the English and Irish training is very similar or the same system.
Well, or they're training in like Europe. Where there's great advances in cosmetic procedures.
The problem in England and Ireland, we've had multiple patients fly over, or people that at least inquire, is there's probably not as many of me over there. There's not as many cosmetic surgeons. Yeah. It's a state-run system, and it's, it makes sense.
Same thing in Canada.
What?
Our Canadian patients kind of run into the same issues.
Yeah, you're right. I mean, I feel like there's a decent amount of representation of cosmetic surgery there, but
do you find it, Nels?
The Royal College of Surgeons in Ireland.
Yeah.
See, I was
first. So yeah,
it's the Royal College. Yeah.
Perfect.
And they have very good training, and I know this because we have international meetings, and you meet them, and they talk about their training. It's very rigorous. It's actually in some ways more rigorous, and it's not as long, but it's pyramidal. Like literally in these training systems, you get in there, and they're like, you show up, and they're like, yeah, you're out. Like you're not good enough, In America, it's a little more litigious.
Like you're not good enough, but we'll drag you along.
Yeah.
We'll see if you can make it.
Right, because we don't want you to sue us. But like in Europe, they're like, yeah, you're not good enough, you're out. So I think you should be very confident in Irish plastic surgeons, but I'm not really sure who I could recommend.
Yeah. Awesome. All right. So back to research we're into, but this time it's research we're into 5.0. And this was just a random user. Episode 135. Thank you so much for this podcast. I am scheduled for my face and neck lift in 4 weeks. I feel very ready and informed now.
I love it. I love it.
Love it.
Yeah.
I mean, that's the whole point. And
that's why we do this.
This is why we podcast. It really is.
Yeah.
I mean, we send our own podcast to our own patients because we want them to be educated.
Right. And empowered.
Yes. The education.
And it works against us because I'll breeze over stuff and the patient will come in and be like, well, Dr. Martin, can we just talk about this real quick? Because you breezed over that. And I
heard this on your podcast.
Yeah, I heard this on your podcast.
Like, well, then you know the answer.
I'm like, damn. Yeah. You're too informed. You're too empowered. But it's so important, and we're so happy when we get messages like this. It means, I can't even tell you how much it means to Amy and I personally, that you, a person we've touched that, just through this medium, that is going to go through surgery and feels confident and is ready for surgery and is empowered and prepared. I mean, I'm sure Nils feels the same way. That means everything to us.
Yeah, we have the greatest listeners. They're so smart, the smartest questions. People who've lost tremendous amounts of weight and turned their lives around and everything. Just hearing from all these people really makes the thousands of hours of work worth it.
Yes. Nils is like, if I have to listen to those two talk one more second of my life.
But it really is. And that's why I love these episodes when we build the slides for them, when Amy sends over all the comments. I mean, Sarah and I are just like, look at this. Like, it just really, it gives us like another boost of energy. Just keep these going and keep them out there because we know we're making a difference.
Because in life, especially now, in this country at least, you don't feel connected. You don't feel like you're a part of something, and you don't get to help people that really aren't part of your little circle. And the fact that just effort on your part with editing, effort on Amy's part by like doing all the work for this damn podcast, and me sitting down once every 4 weeks and talking. But no, seriously, it is really special. I don't want to over-aggrandize, but like I truly think that we've been really fortunate.
Yes, I agree. So if you haven't yet subscribed and you feel so inclined, hit that subscribe button. We would love it. We put out good stuff. All right. This is the final question, or this is the final comment, I should say. This was from our YouTube video about arm lift options and alternative treatments. She said, this is June Harrisico. I don't care if people will know. I hate my arm fat. Absolutely.
Oh, yeah. Preach.
Right? I mean, that is universally true before and after a brachioplasty. People are afraid about the scar, but when you have, like, what is your other option? And most people look at you, don't care about your scar. They really don't.
No.
Like, but if you don't like your fat, like, that's what matters. Like, I hate my arm fat. I don't care if people know. Right? Like, do this. Like, fix something you don't like.
It's how you feel about it.
Yes.
I can tell you, me personally, and it's only my opinion, I would fix saggy arms before I would fix my saggy belly. I would do this first.
Yeah.
Because your extension, your arms are so much a part of your life, everything you're doing, and that's the way it feels, and every movement you make. That would be hard to live with. If it bothers you, fix it.
Yes. No one cares.
You're not going to
regret
regret it. Yeah.
There's a lot of adjustments and clothes around your trunk, but not really
your arms.
The arms. I mean,
No.
I deal with that a little bit too.
You got those big guns?
I got a little bit of guns, but I'll get something like, it's cutting off my circuit, or it's just way too big.
Yeah.
You know what I mean?
Right?
You can't like customize your shirt by sleeves.
No.
You know what I mean? It's
right. And it's like the circumference of your arms doesn't always fit. If you have fat, muscle, whatever, doesn't always fit into the whatever size clothing you're wearing. And it's the worst thing ever. I had that issue. I usually wear a medium because but like sometimes you get these mediums.
And those guns just be busted.
It's not about the guns. It's just about I feel like they're
like in your arm.
Yeah.
Almost like
And you can't move your arm.
Oh, so it's your giant lats. That's what you're saying.
Shut up, Amy. I'm with you.
So June, yes.
Are we mansplaining to June? I'm sorry.
No, but I mean, I love this. And surgery, like cosmetic surgery, is only for you. And that is the good, bad part of it. People think they're doing it for other people, or they think that other people are going to care more. They don't.
They don't
like,
care.
Do this because you don't like
we
it.
care. We care.
Yes. Well, but we care. Yeah. I mean, we care, but we don't matter to them,
Right.
you know? So yes, like do the surgery, like get rid of your arm skin. Love it. No one's going to care about your scar. All right, Dr. Martin. We have answered the questions from listeners.
Then what Sarah put on there is from a video from our YouTube channel, Jason Martin, MD.
Yes, I read the title of it. It's from Arm Lift Options and Alternative Treatments.
Great.
Mhm.
That's actually a really good video because I did some diagrams of exactly where the incisions are and what is treated with each type of arm surgery.
Yeah. So thank you all so much for your comments. We could not have done this episode without you. Literally, we could not have done this episode without you. So if you'd like to
If you weren't here, it would just be Nils, Amy, and I talking to ourselves.
Which is what
we normally do.
That's what we'll do next week. So we have
That's what we do most of the time.
Our next episode that's coming out is going to be mid-October, and it is a really, really good one. I dove deep into Reddit, so there's my teaser.
That's good. I mean, I love Reddit, but that could be good or bad.
Here are all our social media handles below. You can find us everywhere at Jason Martin MD and at Beauty and the Surgeon Podcast. You can also leave me a voicemail or send me a text at 303-630-9038. And we will see you all
You
here
want to show your
next
guns
time.
before we go?
Well, I can't. I got a jacket on. I got to take my. I mean, like, you want to see guns? I got to take my jacket
Yeah,
off.
let's see your guns.
They can't see them through my shirt.
Okay.
They're guns emoji.
There we go.
Yeah. Potatoes.
See you guys next time.
Bye.